We did induce her yesterday. The cows have a 9-month gestation, just very similar to people, and they have about a 2-week window with which a birth can happen normally with no problems within that 2-week window. We know exactly when she was bred. All these dairy cows are artificially inseminated, so we know exactly what her breeding date is, exactly when she got pregnant, so we know exactly what her due date is. Now, of course, we don't know if she's going to actually have the calf on her due date because of that 2-week window, but we pretty much can estimate what that 9 months is around her neck, so she'll walk through, and it'll go right behind her jawbone and close. It's not going to close and constrict her head, because we don't want to choke her. It doesn't close that tight, but it closes right behind her jaw, so that way she can't pull her head back through. She's used to standing and things like this back on the farm, so this isn't anything she's never seen before. Okay, definitely want to stay back away from the railing at this point. Now, one of the questions we get a lot is, how the cow is feeling about all this. You know, she's away from home, she's away from her farm, she's away from her herd, she's got all these people watching her, it smells different, there's lots of strange sounds, we've got all these people trying to, manhandle her and put her in a head gate and give her an exam. And she's not really very happy about it. She is uncomfortable. Obviously, she's in labor, so she's in pain. This is a new environment. She doesn't really know what's going on. But it's not anything that's causing her a tremendous amount of distress. She's not extremely agitated. She's not, becoming violent or trying to injure any of us. Okay, so what we're going to do is to get out of the way. Audrey is going to give her an internal exam. So the first thing she's going to do is she's going to clean the vulva, which is under the cow's tail. She's going to clean that really well, because obviously this is not a sterile environment here. And you don't want to take any bacteria from the environment in with you when you enter her into her reproductive tract, so in through the vagina and up into the birth canal. She's going to scrub her really well, clean off everything possible, because the rectum is right above the vulva, and so you don't want to take any of those bacteria in with you. She's wearing that nice long glove that I'm sure you've all seen in horrible comedy movies where they put on a really long glove. And there's for good reason, because you can go the whole way up to your shoulder and sometimes even farther. They always joke about picking the small girls up and putting them in so you guys have a bird's eye view of the inside. So she's going to gently insert her arm into the birth canal, and she's going to see what she feels. And she'll tell us what she feels, provided she doesn't get kicked. So what she's trying to feel is hopefully a pair of hooves. Now this is uncomfortable for the cow. She doesn't really like, at this point, nothing should be going in. In the cow's mind, everything must be going out. So she's definitely going to work against Audrey. All right, which feet? Front or back? Okay, so Audrey was able to feel 2 feet. About how far in were the feet? Hands width or hands depth or forearm? Okay, so she is free to move and switch positions and do whatever she can to encourage that calf to come out.
Feet move.
Yeah, now if you're watching the feet, you probably saw it move a little bit, which is good. That means the calf's alive. We're happy about that. Pushing really hard, and you can see those front feet. And I know it doesn't look like they're advancing very far, but with every push, they're getting a little bit further. And his tongue moving, but he actually doesn't need to breathe yet. A problem would be is if that umbilical cord became detached before he was born, then he would need to breathe, and that would be a problem. But we're going to assume that everything is just fine because her labor has progressed so beautifully.
I'm going to put the chains on my arm and show them how.
Okay, so what Dr. Hartsock is going to forearms of the calf, and there's actually handles that you can put on the end of the chain to help give you the grip to use for traction. The chains are in a bucket of a disinfectant, because again, this is her birth canal. So it's her vagina up into her cervix. Her cervix is open into her uterus. So we don't want to introduce any bacteria from the environment in there, because then that could cause a serious uterine infection, and we definitely don't want to encourage that.
Clear out of there, we're going to put her in the chute.
Okay, so the vaginal area of the cow, and to help kind of relax those muscles and stretch it open. I've never seen one of these girls tear, but I'm sure that could be a possibility depending on the size of the calf's head. But if you do that massage of the tissue to help loosen it, that definitely encourages the head to kind of slide through a little more easily. Chains on the other leg, and then Audrey will put the next handle on. Alright, so now you keep watching. You put a little lubricant on there. And again, that's going to help. He's trying to loosen that area, get his hand up over the calf's head. And they're pulling, again, with her contractions and not pulling against her. Definitely pulling with her. So watch every time she pushes, they'll pull a little bit further. The next thing we're going to see them do is we're going to drag the calf a little bit further out into the arena. It's a girl. It's a girl. Yay! So it's a little heifer. So what they're going to do next is kind of stimulate her, make sure she's breathing, clear that mucus out from her mouth and out from her nose, get her in a good position so she's not all twisted. Kind of stimulate her, that suckling reflex. You can see her eyes are open, she's looking around. Clean out her nose. It's all right, Mama. All right, so what we've got now is it's a bottle of iodine, and we've got that iodine because we're going to dip actually the umbilical cord where it broke, and we're going to do that to prevent any bacteria from traveling up the umbilical stump into the calf. Just a minute, just a minute. So that'll keep it nice and clean. You can see Dave's kind of tickling its nose with some straw to help it sneeze, to help get some of the membranes and fluids out. You'll see there's a little bit of blood on the floor, not very much blood. That's a little bit from the umbilical cord when it's separated, but you can see it's a relatively bloodless process. Now again, it's going to take some time for her to pass her placenta. Again, it could take a couple days for that to happen.
We're okay.
While we're doing that, drag the calf out.